Hello. The article I read for this current event is called Improving Care Through Public Policy. It was published January 18th, 2018, and was written by Laura Thornhill and Rachel Conant. The publication source is The Gerontologist, which is a journal, in volume 58 in issue 1. This article discusses advocacy by the Alzheimer's Association, and then laws that have been passed and work that has been done to promote care for Alzheimer's patients. So the National Alzheimer's Project Act was passed in December 2017 or 2010, and signed into law by President Obama in January 2011. And it started a focus on policy for Alzheimer's care and the creation of the National Plan to Address Alzheimer's Disease, which focuses on improvement of care, support, and treatment. The Alzheimer's Association also developed a milestones work group made up of experts in clinical care, long-term services and supports, dementia care, and support research and public policy, which works to identify public policies that should be passed in the next 10 years to support Alzheimer's patients. They published the Report on Milestones for Care and Support under the U.S. National Plan to Address Alzheimer's Disease. From this group, they have supported the creation of Public Law 111-148, which it creates an incentive for clinicians to do a cognitive impairment assessment at annual wellness visits. This was passed in January 2011. They also supported the Health Outcomes Planning and Education, or HOPE, for Alzheimer's Act, which provides comprehensive care planning services to Medicare beneficiaries and caregivers following the diagnosis of Alzheimer's disease, and requires the documentation of diagnosis and care planning. This was passed in November 2016. The Affordable Care Act requires states receiving federal funding to develop home and community-based services which maximize independence and self-direction. This includes care for Alzheimer's patients. The Centers for Medicaid and Medicare require nursing facilities to complete a baseline care plan or comprehensive care plan within 48 hours of a patient's admission, and expanded dementia training requirements. These happened in the year 2016. The Palliative Care and Hospice Education Training Act increases palliative and hospice training for healthcare professionals. The article did not provide a date for this. It also did not provide a date for the National Plan Action Number 2.F.1, which promotes exploration of transition of health information. In addition, the Health Resources and Services Administration, the National Institute on Aging, the Administration for Community Living, the National Aging and Disability Transportation Center, and the CDC have all compiled more information about Alzheimer's for the public since the passing of the National Plan to Address Alzheimer's Disease. The Milestones Group, which I talked about earlier in promoting policies for Alzheimer's patients, also wants to see policies come into being that promote building a workforce with skills to provide high-quality care to Alzheimer's patients, increase public awareness campaigns about Alzheimer's not being a normal sign of aging, and to reduce Alzheimer patient transitions from facilities, which is a common problem for Alzheimer's patients. All of this happened because the Alzheimer's Association met with public officials and to discuss these issues and possible policy changes. I chose this event because I'm a healthcare administration major who has worked at a nursing home for a long time now. I'm very interested in the aging population. This relates to public administration because it is discussion of advocacy and policies being passed. Thank you very much.